Everyone, welcome to GrowMed. Welcome back to a session where we will be discussing some important diseases and the quick buzzwords which we must remember. So, we'll not go into much detail about those things. The important diseases which have been asked repeatedly and what all things you must know. See, these are the purely revision or recall kind of videos. Do not completely depend on this. These are to boost your preparation. Like if you're missed any topic, so it is to in the last minute so that you will at least have an idea about the topic. For that, this is the purpose of those with these videos. Okay, so see, first one is the acrodermatitis enteropathica. Short question asked in multiple exams. One question you can expect in the upcoming exam also on this one. If you go and analyze the PYQs, all the exams this question is asked. So it occurs mostly due to the deficiency of the zinc. Zinc deficiency is the cause, and these are the clinical features: dermatitis, dementia, and alopecia. If not this, they can be described like dementia as rashes on the genital areas and uh, perioral area around the lips and the mouth. The rashes will be seen, the dementia, and they can describe like thinning of the hair or the hair is falling. And the other thing also associated with this zinc deficiency is the poor wound healing. So that also can be described in the case. Because of the poor wound healing, that is why the rashes have been formed. Okay, poor wound healing. Then moving on to the next topic, Burkitt lymphoma. So the important things to remember from the Burkitt lymphoma, I'll just note it down, which all the questions have been asked on. The questions have been asked on the causative organism, that is the Epstein-Barr virus. Along with this, Epstein-Barr virus again also causes other diseases like the nasopharyngeal carcinoma and the Hodgkin lymphoma. So note it down, these two important things also. So I'll be discussing like this. एक टॉपिक के साथ if anything other than that which you have to remember, that also I'll discuss here. So this was the question asked, the gene mutation in this Burkitt lymphoma. So c-MYC is the gene mutated, and this was asked in the recent January 2025 exam. Then the gene uh, is present on the chromosome. So the translocation of the gene occurs in the 8th and the 14th chromosome. So remember this also, because these can be described in the clinical case, or they can describe a case and they can ask translocation of which gene causes this. So in the clinical case, this will be described, or the image of an African child will be given, and with that jaw swelling, important one. So one side of the jaw will be swelling of the African child, and on the biopsy, yes, is starry sky appearance. Image based question can also be asked. So have a look at the image also, starry sky appearance. So these are the important things which you must remember from the Burkitt lymphoma. Then moving on to the next disease, that is the Wilson's disease. So it is an autosomal recessive condition, and the gene mutated is the ATP7B gene. And the important things, buzzwords which you must remember: KF ring, so deposition of the copper in the decimus membrane and around the cornea, it gives a brown color ring in the eye. So for detailed explanation, you can buy the 200 short topics in which all these diseases have been discussed in detail along with the images. But as we don't have much time left now for the exam, so I suggest you to just read the buzzwords, so that in exam, if at all a question comes, you will be able to solve it. So sunflower cataract and the serum ceruloplasmin is increased. So these are the buzzwords which you must know for this Wilson's disease. And investigation, see, for the screening, it is the serum copper levels, testing of the serum copper levels, and this is usually very high. And for the diagnostic, it is the liver biopsy, and in the liver biopsy, we will be looking for the hepatic copper content, as the copper is deposited in these cells. Hepatocyte, the copper content in the hepatocyte. So this is the diagnostic investigation for the Wilson's disease. Then moving on to the next, cardiac tamponade. So causes, most common causes, iatrogenic. Iatrogenic means during any surgery, a mistake by a doctor can lead to this cardiac tamponade. Second most common is this trauma. Whenever the in a road traffic accident, this might happen, cardiac tamponade, when the chest is hit to the steering wheel. Okay, then Beck's triad, remember this one, very important one. Questions have been asked on this Beck's triad. So what all comes under this? See, three things: congested neck veins, then decreased in the BP, that is the hypotension, and muffled heart sound. So these are the three things which will be coming in this triad. Okay, Bextride. And on the JVP, this is also a very important one. Jugular venous pressure itself is a very important topic, and if you want, a video is there in my YouTube channel. I will give the link in the description box discussing this JVP. You can watch that video, a separate video for this one. So on the JVP, steep X and absent Y wave can be seen. Then on ECG, electrical alterance is seen, and on X-ray, money bag appearance. So see, if it is just X-ray, you can see like a bag is kept. So because this is the heart, and around the heart the accumulation of the blood gives this appearance. And treatment is by the pericardiocentesis, removal of the blood surrounded the heart. Okay, so yes, this is the pathology. Is only this one about the cardiac tamponade, that the blood is filled around the heart. Okay, then next topic from the surgery, a very important one, fibroadenoma. So this is a benign tumor of the breast, and it is also called as a breast mouse because it is mobile, freely mobile, and when you examine it, you can hold the lump of the breast, and it is movable. Okay, it is not sticked to the chest wall, or it is not fixed. Okay, then most common in the young females. Remember this one, always in the clinical history they will be given a young female. Then on mammography, you can see popcorn calcification, again an important investigation finding, and investigation of choice is the FNSC, and treatment is the excision. And excision also, it depends. If the size is very big, then only we will be doing like more than 5 centimeter, and for the cosmetic purposes, if the patient want, then only we will be giving the treatment, that is the excision. Or rest, if it is very small and not affecting the patient much, then we will be keeping it under the observation. Okay, so this is about the fibroadenoma. That's next, moving on to the ranula, again a very important one, and this is a mucus extravasation cyst. So it arises from the sublingual gland. So this was a question asked, that ranula is which kind of cyst. So it's a mucus extravasation cyst, and this is the feature of the ranula. It is a bluish translucent cystic swelling at the floor of the mouth. Okay, then treatment is the incision and drainage, and if it is recurrent, then only excision is done. So in the clinical case, questions have been frequently asked on the treatment, and they have been confusing. If they are mentioning recurrent, then only the treatment is excision, then only choose the option as the excision. Otherwise, incision and drainage will be the best treatment. Okay, then croup, again a very important one in the pediatric age group. So most common cause is the para-influenza, and it is a biphasic stridor. The clinical features or the presentation, it comes like something like biphasic stridor is seen in a child, fever and the barking cough. And investigation of choice is the X-ray. On the X-ray, you can see the steeple sign, and for the treatment, it is usually the conservative management. We will be using humidified O2, steroids and bronchodilators. So this is how the baby is managed for the group. Okay, so these were some important things, and I will share the PDF in my Telegram channel. For the PDF, you can join my Telegram channel and you can take the PDF from there, and I will be also attaching the important images, and then I will share this PDF. Okay, so thank you so much for watching this video. Around in some 10 minutes, we have discussed very 6 to 7 important diseases. So I think I hope this video will be helpful to you in the upcoming exam. If you like the session, share the video with your friends. Subscribe to GrowMed if you're new to GrowMed. And also you can follow me on Telegram and Instagram. The link is given in the description box. Once again, thank you so much guys for watching this video. I am Dr. Padmini, your mentor for the FMGE. All the best. Thank you.